All right, let's go ahead and get started. Hello, everyone. Good afternoon. Thank you for joining us today to hear about the impact of marijuana legalization on employer drug screening policies and practices. So glad you're here today. Let's get right to it. My name is Frances Huntley. I'm the Strategic Partnership Program Manager at the Minneapolis Regional Chamber. I lead the Chamber's MSP Wellness Initiative, which I'll talk about briefly at the end of our time today. First, I just want to say we're here today because we partnered up with our friends at Vault Workforce Screening to offer this programming and hopefully more in the future, and also to offer Vault services at a discounted rate through a new affinity program. We're really excited about this. We're so grateful to be working with Jordan and RJ and Sean and all the nice folks at Vault. Please reach out to me or Sean if you have any questions about that or about Vault services after today. Go ahead and move to the next slide, and I'll go ahead and introduce Sean O'Neill and let him get right to the subject matter here. Sean is Vault's Compliance and Privacy Officer. He's a well-known and respected name in the industry, having over 20 years of experience in leading consumer privacy, regulatory and legal compliance, driver safety and recruiting, customer operations, training, data analysis, and process design. Sean, thanks so much for being with us. I'll turn it over to you. While Sean's pulling up his slides here, I'll just let everyone know to please use the Q&A feature at the bottom of the screen if you have questions. Sean will receive those and he'll be able to address them either during or after the presentation. So please ask questions. We'd love to hear from you.
Great. Thanks, Frances. Thanks, Amy, for having me. I am Sean O'Neill. I am the Compliance and Privacy Officer at Vault Workforce Screening. Vault Workforce Screening is a full service provider of employment screening services. We're a third-party administrator for drug and alcohol testing and medical review officer services. We're accredited by the Professional Background Screeners Association, so we are able to provide consumer background screening reports, criminal checks, MVR reports, and so forth. We also provide occupational health services when it comes to employment, such as OSHA respirator examinations, commercial driver medical examinations, and so forth. As well as we have a recovery monitoring services program, which deals with professional health recovery, those licensed individuals who need to be in a monitoring program to retain their licensure. We've been dealing with drug and alcohol testing for over 30 years. So the topic today of marijuana testing and state law changes, this is near and dear to us. We're asked daily about what employers should be doing in this space. And the first question that tends to come up, especially even following the pandemic, is, should I as an employer continue to drug test my employees? And I would say that answer is a strong yes. There's been a number of surveys and studies done from groups like the National Safety Council that actually indicate drug testing has been drug use has been on the rise since the pandemic. In a recent survey of employees, 20% of employees stated that while working remotely, they do utilize alcohol, marijuana, or other drugs while they're on the clock. And of those respondents, 73% of them said they actually see it as a benefit and they wouldn't want to return to working in the office because they would lose that ability. So, as our workplaces change to be a more remote workforce or a hybrid workforce, it does introduce more opportunity for individuals to use substances while on the clock. We're all getting used to, working in the virtual environment. We're all on a Zoom call today. A lot of, employment meetings now occur over Zoom. There was a survey that 22% of employees admitted that while on virtual meetings, they are using marijuana or alcohol or other substances under their influence. And 21% of those surveyed said, I've actually been able to tell a colleague of mine on a virtual meeting is under the influence of some type of substance. Another survey found that 1/3 of Americans admitted to increasing their alcohol consumption coming out of the pandemic. And 29% of self-reported drug users stated they actually increased their drug usage during and following the pandemic. So the use of substances have not gone down, it's actually increased. And we're seeing this in things like the Quest testing index data that's published every year. We're seeing positivity rates go. So the first answer is, should I continue to drug test? That's a yes. I believe you should continue to drug test. Now, how you drug test, what you drug test for, that becomes nuanced as state laws continue to change. And as we're, going to be talking about Minnesota state law, that's all something that we need to be thinking about when it comes to our drug testing programs. And there's been a lot of activity on the marijuana law perspective. Going as far back to the election of last year, we saw Maryland and Missouri pass recreational marijuana laws. What was actually surprising in the election, there was kind of a pause in the green wave that was going across the country. Both of the Dakotas and Arkansas, actually their initiative to pass recreational marijuana actually failed in those 3 states. That was the first time we kind of see failure occur. So it was interesting to see. But then coming out of the election and this year, every month for the last 3 months, we've had a new state pass some type of law with regard to marijuana. Kentucky passed their medical marijuana law in March of 2023. Delaware passed their recreational law in April. And as I'm sure most of you are aware, Minnesota has passed their recreational law in May. Last summer we had where it was passed as law, the use of edible and drinkable THC in certain quantities was approved, but there was no infrastructure approved around it. And that now has course corrected with the passage of the law that came in May of this year. Minnesota becomes the 23rd state to legalize recreational marijuana. Along with seeing changes occur, approving recreational or medical marijuana, we're also seeing states pass laws about what employers can and cannot do when it comes to drug testing for marijuana. 2 laws that are going into effect in January are California's AB 2188 and Washington State's SB 5263. These are putting limitations on employers for actually testing for marijuana in their states. They're also prime examples of where legislature has gotten ahead of science. So in California, the law is written that employers cannot take adverse action with regard to employment, whether that's hiring, termination, advancement, stand downs, what have you, based on testing for the detection of non-psychoactive metabolites of THC, which is a mouthful. What that means is if the employer is going to drug test, they can't make a decision based off of a metabolite. As we consume marijuana, whether that's by edible or drinkable or smoke, the body breaks down the THC into metabolites. So what the law is saying is, 1, you can't test for and make a decision based on the metabolite. They go further to state you can't base it on a non-psychoactive metabolite. One of the limitations with drug testing today is drug testing can't detect impairment. It can't detect psychoactive versus non-psychoactive. So as you think about alcohol testing, we have a scientifically proven test where we can do a breathalyzer on an individual, and based on the reading of that instant breathalyzer, we know if the person is impaired by the alcohol or not impaired by alcohol. That doesn't exist when it comes to drugs. Drug testing can detect the usage, the consumption, the presence of a drug, but it cannot detect impairment yet. The science isn't there. So California and Washington, are creating kind of a challenge for employers in that state. And while we're going to be talking about Minnesota, it's also important for, companies in Minnesota, if you have employees who work remotely in these states or have satellite offices in different states, you have to be aware of their marijuana testing laws as well as your own home state's testing laws. So it's really important to understand what's going on across the country if you do have multiple locations. it also gives you a sense of where state legislatures are going, because, for example, California's law is really a carbon copy of what Washington did, where Washington prohibited just at pre-employment level. California is across the board. So states are kind of watching what each other do, and they're kind of starting to build upon previous past laws. And then we are also seeing pending legislation sitting in New Hampshire, North Carolina, Ohio. So we're continuing to see states queue these types of laws up. So as we think about what does it look like from a map perspective, here's how the states fall out. Here's what it looks like. Your dark green states are your fully legal states. So we've got 23 of them. You then have states that still have passed medical marijuana, but they have not taken any action with regard to recreational. You have a grouping of states that fall into what are called CBD/low THC states. These are states like Wisconsin, where a certain percentage of THC can be used to treat childhood seizures. It's very specific, it's very controlled. You can't get it at a dispensary or anything like that, but there is a law on the books that may allow for THC, or these are states where CBD products can be readily purchased. And then you have 3 states that continue to have laws that prohibit the use of THC or CBD in any form. What's interesting to look at is, what does this mean from a population standpoint? So with Minnesota passing their recreational marijuana law, that now brings the US population to 50% of the population live in a state where they have full access to marijuana, or will soon have full access once the infrastructure is set up. So while Minnesota has become the 23rd state, there's now the process of setting up the infrastructure to make recreational marijuana available. As you take a look at adding in then medical access, you're now looking at 75% of the US population live in a state where they have some type of legal access to marijuana. And this access is not uniform across the country. Every state's handling it differently. And so this can cause, challenges for employers as we're looking at, should we test? How do we test? When can we test? And while it does seem to be challenging to figure out what the rules are, there is a process you can go about to do this, to make sure that you are compliant with regard to testing. So as we think about workplace testing for THC, there's really kind of a 3-step approach that you can take to make the decision, because there isn't one uniform approach. Every company is different. The employees that they employ are different, the class of employees, the regulations they may fall under. So it really has to be a company by company assessment to determine if you can and want to continue testing for THC within your drug testing program. The first question you should be asking yourself, and this is the easiest question out of all of them, is, are you required to test under some type of regulatory authority or statute or law with regard to THC? So as you think about it, if you're an employer that falls under the Department of Transportation, whether that's the Federal Motor Carrier Safety Administration, the Federal Transit Authority, the Federal Aviation Administration, what have you, they still require testing for THC within their program, because at the federal level, THC is still a Schedule I drug. So if you're if you're subject to federal authority, you still have to test for THC regardless of what the state law says. Now, that doesn't get you a get out of jail free card, because while you test the employee population that are under federal authority, you can't blanket that across all of your employee population. And what I mean by that is, if you fall under DOT, let's say you're a motor carrier, yes, you have to test your drivers for THC, but that doesn't mean you automatically get to test your accountant under that same authority. That accountant role falls under non-DOT, so now you have to look at state law. So there's no get out of jail free card from looking at state laws. You have to be aware of that. If you're a federal employer or contractor, the mandatory guidelines for workplace drug testing would also apply to you. So that's another federal authority to be aware of. Once you kind of answer the question as to, do you have any type of federal authority that you have to follow? Then you want to ask yourself, what states am I testing in? So again, if you're in a scenario where your headquarters is located in Minnesota, but you have offices, let's say in California, New York, New Jersey, and Wisconsin, those 4 states have very different laws regarding marijuana testing, from no law present to very restrictive laws regarding marijuana testing. So what you want to do is really map out, where are you going to be testing for drugs? And you don't have to have a physical location in the state. If you have employees who work remotely in that state, you have a presence. And if you're going to test that employee, you want to make sure you understand the laws of that state. Now, if you're headquartered in Minnesota and you have no remote employees outside of Minnesota, you have no offices outside of Minnesota, then it's an easy approach. You have to know what Minnesota allows for. So that's a much easier index to create compared to someone who may be testing in multiple states. Once you know your footprint, then it's understanding what the state laws allow for. And generally, you can get to this by asking yourself a couple different questions, and this would apply to any state law, whether it's Minnesota's new law or laws like California and Washington. The first thing you're looking for is, does the law state anything about, can you test for it? In some of the earlier states that passed recreational marijuana, that law didn't include any information about, can employers test for it? What we're seeing now, as some of the more recent laws are being passed, like Minnesota's, it is addressing whether or not you can test or can't test for marijuana and in what scenarios. So the question you have to ask yourself is, can you test for it? If it's yes, then you have to ask yourself, who can you test for? Because in some state laws, it'll state you can test for it as long as it's allowed by state law or required by a specific state law. So you have to know your employee population to determine, is there a law in the state of Minnesota that requires me to drug test this type of employee? Or is there a law that prohibits me from drug testing this type of employee? So you have to think about who you can test for. An example of this, again, if you're a provider, if you're an employer who employs across the country, in California, the AB 2188, while it's a very restrictive law that's prohibiting the drug testing through urine drug testing, they actually exempted out the construction industry. So often, safety sensitive type industries or safety sensitive type roles will be exempted out. So you have to understand if the law has any type of those exemptions in place. Then as you take a look at the law, you have to determine, when can you test for it? Because there might be, yes, you can test for it, but in the example of Washington, you're not able to test for it for pre-employment purposes. Are there criteria about reasonable suspicion? What we saw coming out of New York is the Department of Labor said, if you're going to test for reasonable suspicion, you can't test based on the presence of marijuana odor on the employee. So they're limiting what steps you can use. In states like New Jersey, you have what's called the workplace impairment recognition expert that has to get involved. So you have to really understand the nuances within the law. So, taking a look at the new law passed by Minnesota, it's determining, is your employee population exempted from the law? Or is there a state law that requires drug testing of that employee class? And then with the new Minnesota state law, if you can test for it, can you test for reasonable suspicion? Can you test for random? You really want to understand how that applies to your employee pool. And there's not one simple answer usually. It's based on the type of employees that you employ. Then you want to take a look at making sure the laws that you're looking at don't have any language about what you can test for, such as, there are certain states where prohibit testing of like hair testing or oral fluid testing. They're few and far between, but there's a handful out there. Then you want to take a look like the California law that prohibits the use of metabolites. So you want to understand, within the law, what you can and cannot test for. And then finally, with the states that do have medical marijuana, like the state of Minnesota, you need to understand if you have to make accommodations. Generally, there's no state out there that I'm aware of that says, as an employer, you have to allow the employee to use while on company time, on company property. I've seen no law that requires employers to do that. But if the employee is using on their own time and they're coming to work and they're saying they're not impaired, but they pop positive for a drug test, do you have to make some type of accommodation for that employee? So that's something you need to be aware of when it comes down to the employee specifically. And now we're looking at ADA implications. So once you've kind of done your state assessment, once we kind of look at the new Minnesota law and we determine, can we test our employees under this law? When can we test for our employees under this law? Then you need to start putting your operational procedures into place. So if you're only testing in the state of Minnesota, if you have no federal authority you have to test under, this answer is pretty easy. You're going to test based on what Minnesota allows you to test for. If you're a company that has offices in multiple states and you have to test under federal authority, you need to determine, do you test everyone the same? Can you test everyone the same? Or are you going to handle it individually, state by state, employee role by employee role? And also looking at it by different test reason. What you're going to want to do if you're a company that is testing in the state of Minnesota as well as other states, it's important to have a process documented in place ahead of time. What happens when the wrong test is performed? So what I mean by that is, let's say in the state of Minnesota, you're not going to test for THC for your employees. You're going to test for other drugs, but you're not going to test for THC, except if they are under federal authority. Then you're going to do a 5-panel federal drug test, which has THC on it. Well, what you have to have a process in place for is, what if when you send one of those non-federal employees in and they test for THC and that person is positive for THC, but your drug testing policy says you're not testing them from THC? What are you going to do in that scenario? Now, depending on who you're working for with your drug testing provider, hopefully they have practices in place to catch this. So for example, at Vault, when you place an order for a drug test based on the panel you've selected, when the result comes in, we validate that what was ordered was what was conducted. And if it's not, we put a stop in place. We work with the labs to reprocess it, so you don't even know it happened. Your exposure is limited in that type of scenario. But you want to have a process in place, or be working with your drug test provider to make sure they have a process in place. In states that allow for medical marijuana, which again Minnesota does, you want to determine if you're going to attempt to validate medical cards. Marijuana is not a prescription. Marijuana is a Schedule 1 on the federal scale, and that means it can't be prescribed. So marijuana medical cards are a referral, and there's no way to validate them. If it's a prescription, we can call a pharmacy, we can validate the last fill date, we can validate the last fill amount. Most states don't have that when it comes to marijuana medical cards. In the state of Minnesota, law enforcement can issue a warrant, to have access to the registry. Minnesota medical providers can have access, but generally employers and providers outside of the state of Minnesota can't have access to it. So you have to make a decision as an employer. Are you going to validate, is that medical card expired? Is it valid? How are you going to do that? Because it is a challenge to do. Then as you look at your program, if you decide to remove THC, because you can remove THC, you can still test for other drugs. If you want to continue to test for cocaine, if you want to add fentanyl to your drug testing panel, if you want to test for opiates and opioids, the laws on THC don't impact that. So you can decide, we're going to remove THC from our panel, but I'm going to test for other drugs of use. Or you may decide I'm going to test for THC on this employee pool because I'm able to under the law, but I'm not going to test for this employee pool. You want to make sure if you're going to touch your drug testing process that you are updating your drug testing policies. Before you update that policy, anytime you change your drug testing program, you want to run it by your legal counsel. Because again, there's not one approach that can be taken here. It's based on the employee pool you employ. It's based on the industry you're working in. You want to make sure that you have legal counsel take a look at it. Once you do that, once there's sign off on the changes you're going to make, it's really important that you're training and notifying the staff of changes to your drug testing policy. You can't just make a change to the policy without educating your staff to those changes, because that's going to set you up for risk of claims being made about either discrimination or targeting, or unfair termination or unfair hiring practices. You want to make sure that you get that information out to your staff. And then you want to make sure you have sign off from every employee that is subject to that drug testing policy that they have received the materials and that they acknowledge receipt of those materials, and put that sign off within their employee file. If you're if you're subject to federal authority like the Federal Motor Carrier Safety Administration, you're actually required under DOT regulations such as that to actually capture that sign off. That's just a good practice overall when it comes to changing your drug testing policy. So that is a lot. Want to open it up to questions, and it looks like we've had some come in. So let's kind of go through these. So the first one, the first one is, how do we keep up with constantly changing state laws? The best way to do that is to partner with someone, whether that's you have legal counsel on hand, whether that's in-house or external legal counsel that's monitoring this for you, or partnering with a company like Vault as a third-party administrator of drug testing. We are keeping up on all these state laws because they do impact our clients. So it's working with who's ever providing you drug testing to make sure that they are giving you education, they are updating you on those state law changes, they are helping you out by reviewing your drug testing policy to make sure it's compliant with whatever laws are in place. So you can take that work on yourself, or better yet, partner with someone to help you out in that space. The next question is, will we be sharing the slides? I will defer to Francis and Amy on that one. I have no problem sharing our slides, so if they are being shared, I have no problem with that.
Absolutely. We can share these out to the participants via email after this if you'd like to, Sean. Thanks.
Perfect. Awesome. Yep. More education you have, the better. What are 3 things I need to tell our senior leadership to do ASAP? This is a great question. The first thing is, telling senior leadership, 1, we need to take a look at our existing policy. What is our current drug testing policy? 2, determining what authority you have to test under. Having someone do that work for you or doing it yourself. And then 3, comparing what you're currently doing, comparing to what your index of authority tells you can do, and then make changes to your drug testing policy. And I would say 4th, educate your employees on it once you make those changes. And again, you can do that on your own. You can work with your counsel on that. You can work with other companies to help advise you on that. But it's really the first thing you have to do is assess your current program against what's occurring within the states that you're testing at. What are the potential risks if we don't follow state laws? For example, we are a DOT and accidentally test an accountant. So that can depend, so let's say you are a DOT and you accidentally test that accountant. During an audit by the DOT, they're going to pull your random employee file. So they're going to pull the file and they're going to look through the employees that were in the pool, And if they see you included non-safety sensitive employees in there, that could be a ding on the audit. And that could result in fines or sanctions from the DOT during the audit, depending on what else they find. From a state law perspective, if you're testing for marijuana and you shouldn't be testing for marijuana or drug testing in general, or testing the wrong specimen type, what have you, it's really then, does the law, allow for personal right of action, on behalf of the employee. So you could find yourself being subject to lawsuits, you could, and so forth. So, there are risks to this. DOT audits often, whatever agency, whether it's Federal Motor Carriers, FTA, FAA, they love to audit. And one of the first things that they do during an audit is they look at the drug and alcohol testing program. Do I see future Minnesota drug laws following other states? Can you expect a similar process? I think from what I've read, of the current Minnesota law, yeah, there is law language in there that's very similar. It's not as restrictive as California and Washington, but it does have some address, to when you cannot drug test. So I don't think, I don't have a crystal ball, but I don't see as going the restrictive route of like a California, Washington, New York, New Jersey. But I think there are going to be some things that Minnesota employers have to navigate within the law to determine whether or not they can test their employee population. Would love your insights on what other states might do in the future. Crystal ball. I really wish I had that crystal ball. But what we're seeing change in the state law process is, some of the earlier states, like the Colorados, and when they passed laws initially, they didn't address employment, and they really left it up to case law to determine what employers could or could not do, and that's kind of a mess. We are seeing now, as states are passing medical and recreational laws, they're incorporating in addressing what employers can and cannot do with regard to drug testing. So seeing that the infrastructure is being put in place, seeing that employment is being addressed is a good thing. What we would love to see is that the legislature doesn't get ahead of the science. A lot of the laws are written about impairment, and again, there's not a tool as of today that can detect impairment by drug. It can only detect consumption of the drug. So I think we're going to still see the use of the word impairment or psychoactive versus non-psychoactive, unfortunately. And hopefully science catches up, with the law. There are some technologies out there that, are being tested to see if they can come close to impairment, but even they say they can't detect impairment yet. All right. How often do companies fail DOT audits? Often enough. It's not the norm, but we have a number of companies that come to us because they've struggled in a DOT audit and they've told they need to get a proper program in place. Generally, it's newer companies, often going through their first DOT entrant audit that see the struggle. But I will say the drug and alcohol program of a regulated company is generally the first place that DOT audits. So you want to make sure you are tightly shored up there. And the nice thing is with DOT drug testing, the rules are clear. Like there is a roadmap to easily be compliant with DOT drug testing. What goes in your company policy? Under a FMCSA employer, there are 12 items that specifically have to be in your drug testing policy. It's easy. A lot of the work is done for you. So again, partnering with a company like Vault, we can help make sure that if you're in the DOT space, that your program is compliant. How are healthcare systems navigating this for their employees? Healthcare systems, there's a bit of a struggle there. They're looking at, based on the state law where they're placing, healthcare. what does the state law require regarding licensure? What does it require regarding, hiring of, nurses, physicians, phlebotomists, what have you, based on the role? What does the state law state about what you have to do from an employment screening process, whether that's the background screening check, whether that's the drug test, if it's, obtaining certain procedures under OSHA, like a respirator fit test. It's really understanding what the state law is. So as states continue to pass marijuana laws, healthcare systems need to understand what those changes are. Often the marijuana law will state, if they are going to put prohibitions in the law, it'll state unless required by federal or state law, and that's kind of the carve out. So if state law requires you drug test your nurse, you want to take a look at the new law that's being passed on marijuana and say, does that get carved out? Often it does, but you do need to check, because in some states like New York, it may not be. Can you talk about the latest with oral fluids? I could talk for another hour on oral fluids. And if that's something that you'd like me to have come back on, I will talk about oral fluids for another session. But quickly, DOT has passed oral fluids. So as of June 1st, the use of oral fluid under DOT drug testing is allowed. Federal contractors, employers, it's been allowed since 2019. The challenge is none of the labs have been certified to process regulated oral fluid drug testing yet. The labs are waiting on the devices to be made and to be certified by DOT, and then the labs will go through the certification process. We need 2 labs to be certified before it's allowed under DOT. So hopefully by end of this year, start of 2024, we have our 2 labs up and running across the country, and we can do oral fluid. I think oral fluid is a great testing methodology. It detects marijuana sooner. So it can detect marijuana within 15 to 30 minutes after the person used it. But it only detects for maybe upwards of 48 to 72 hours. So it has a shorter cutoff window. Oral fluids are less invasive for the person providing the specimen, the person collecting the specimen. You don't need to have a secure bathroom. The test is always direct observed. So the ability to cheat the drug test is much harder to do. So there's a lot of benefits to oral fluid. I wouldn't say, an employer should transition their entire drug testing program to oral fluid. I think it's a balance of urine and oral fluid for a well comprehensive approach. But again, I could talk about oral fluid for days on end, and we'll gladly come back and talk about it if you want. We drug screen everyone during pre-employment, even non-safety sensitive roles. Should we stop? We just always fell back on being consistent across the board. So what I think you should do before making a decision is do an inventory of the roles that you're hiring for. Are any considered federal safety sensitive, non-federal safety sensitive? Within the law, are there carve-outs for that role? Are you testing in multiple states? So again, I think you want to determine what authority you're testing under, what state footprint you have, what the roles are, and then balance it against the law. So I don't think you should make a quick reaction and say, we need to stop immediately. You need to do the research. The best thing, start with the research, start with the mapping, work with legal counsel then to determine if you're going to test or not test. I think that is it. There was one question in response to the first, we're not required, correct? I'm not sure what that applies to. So if that person that put that question in wants to clarify, but hopefully we covered it in our other questions.
Great. Sean, thanks so much. That was a wonderful presentation. I know I learned a lot, so hopefully everyone else is feeling the same. To end today, I just want to give a quick shout out about a couple of programs within our MSP Wellness Initiative at the Chamber, and specifically our Champion Designation program that's open for applications right now. And then I will let you all get back to your day. For those of you who may be new to us, MSP Wellness is a partnership between the Minneapolis Regional Chamber, the Hennepin County and Minneapolis Health Departments, and health partners. We are all working together to provide tools, resources, and programming for employers to help them support employee wellness and cultivate a culture of health and well-being in the workplace. We have a couple of programs that we currently run through this initiative that I want to share with you briefly. And the first is the Champion Designation Program. Amy, if you want to just move one more slide, thank you very much. That is our recognition program for businesses and organizations in Minnesota who are doing great work in the employee wellness space. The only thing you have to do to qualify your organization to be an MSP Wellness Champion is go to mspwellness.com/champions and fill out a one-time application. And if you qualify, you receive a number of promotional and recognition benefits throughout the year, and particularly at an annual event in November. So please apply if your organization has an employee wellness or well-being program and is actively doing that work. We'd love to have you as a 2023 MSP Wellness Champion. And the last thing I'll share with you is that our Minneapolis Micro Grant Program, this is done in collaboration with the City of Minneapolis. We administer grants from the Minnesota Statewide Health Improvement Program, SHIP for short, to businesses in Minneapolis to implement projects focused on changing workplace policy systems and environments. These microgrants are really designed to be a catalyst for organizations who are just starting on their workplace wellness journey. We have this great group of 12 organizations doing that work this year in Minneapolis, and we will open applications back up in January if anyone's interested or if you know of a small business who may be interested. Please feel free to pass that information along. It can all be found at mspwellness.com. That is it for me. Thanks so much again for joining us today. My email's here if anyone has any questions for me or Sean. Enjoy the rest of your day, everyone. Bye-bye.